Commercial snack food products included cookies or biscuits, candy, chocolate, chips or crisps, or cakes or donuts. And what we can see quite clearly in this slide is that across all four cities, the rates were highest reported for commercial snack foods. It is also important to note that in Phnom Penh, the rates of promotions for breast milk substitutes were also extremely high. And it's, I think, also a good thing to note that in all four of these countries, there are national policies aimed at regulating the marketing of foods specifically for children, such as breast milk substitutes and complementary foods, but that snack foods are not necessarily included in these policies. Looking at consumption, this slide shows consumption of commercial infant cereal among children at 6 to 11 months and 12 to 23 months of age. And we can see in Dakar and Kathmandu, around a third of children were consuming infant cereal. And for all four study sites, rates of consumption were higher among younger children as compared to children 12 to 23 months of age. In contrast, this slide shows us consumption of these commercial snack food products that I mentioned among the same age categories. And here we can see that snack food consumption is much higher than a commercial complementary food. And that, in contrast, children that are older, 12 to 23 months of age, were more likely to have consumed these products than children 6 to 11 months. So we see this trend as a child moves into the toddler stage. Snacking and consumption of commercial snack food products is increasing. And this is looking at some of the actual specific types of foods that were being consumed in this snack food category across all four cities. And it's interesting to note that in certain places there's preferences already for what types of foods these young children are eating. And so we see in Kathmandu there's a larger consumption of sugary snack foods such as candy and chocolate and cookies and biscuits in green. Whereas for Dakar and Phnom Penh, consumption of savory snack foods like chips were much more common. And when we scale this back to the week prior to interview, we see that consumption rates are even higher, as would be expected as you're looking at a longer recall period. So in the bars to the far left, you can see that the majority of all children in these four cities had consumed a snack food in the prior week. But we also wanted to look at, well, what was the frequency in that last week? How many times had they been consuming a snack food product? And here we show each of the four study sites focusing specifically on the most commonly consumed snack food type and how many days in the prior week they consumed this product. So looking at Kathmandu and Dakar, we see that around a third of those children had been consuming the preferred snack food type every single day in the prior week. And when combining the blue and the yellow, that gives us a range of children consuming between 4 and 7 days in the prior week. And there we can see that for Phnom Penh, Kathmandu, and Dakar, over half of these children had been consuming these snack foods that frequently. Unfortunately, what we don't have information on is how many times per day these snack foods were consumed. We asked mothers to report on the main reason why they chose to purchase these products and feed them to their young children. And what we can see here is that child preference is playing a very strong role. In the light blue at the bottom, that denotes that mothers reported that they fed these products because the child likes it. It gave pleasure to the child to feed them. But in similar realm in terms of child preference, what we see in red is that many mothers gave the response that the child demanded the product or they cried for the product. They had seen another child eating it and they wanted it, which I think is an interesting thing to note given evidence around brand recognition, which is supposed to start to begin around 3 years of age. And we can see here that even children 6 to 23 months are starting to recognize these products, maybe it's packaging or the shape or something like that. So that's also something to consider. And finally, in the yellow, we can see the influence of convenience for mothers, particularly in Kathmandu. Many mothers reported feeding these products because it was a convenient food choice. Just some other pieces of information that came from the data that were influential factors was, again, the influence of child preference. 17% of Kathmandu mothers reported that they wanted to avoid feeding these food products because they believed that they were unhealthy for their child. But yet, when we looked at if they had fed these products, almost all of them had fed a snack food product to their child. And the reason that they said they did it was because the child liked it. It gave pleasure to the child. Also, cost may be a very influential factor. We asked mothers to report what is the average amount of money they spend each day on these different snack food products. And in the 4 bullets, you can see the range of amounts spent in US dollars for each country. And so in a place like Kathmandu, where the average daily food expenditure for a household is around $3.50, the equivalent of 5 to 9 cents for snack foods is very minimal. We also saw in Kathmandu that mothers from non-privileged societal groups were more likely to feed these products to their children than mothers of privileged societal groups. And also, we found some interesting information regarding perception of these foods as intended for young children. We asked mothers specifically, what commercial complementary foods do you feed your child, meaning foods that are intended specifically for infants and young children. And we also asked these mothers to report the brands of the food so that we could verify that they were indeed commercial complementary foods. In Phnom Penh and Dakar, many mothers reported things like puffed rice crackers or cookies or biscuits that were actually snack foods, but they believed that they were intended specifically for infants and young children. In conclusion, what we can see is that consumption of these products, commercial snack foods, is highly prevalent in Dakar, Phnom Penh, and Kathmandu. Levels were lower in Dar es Salaam. And we can also see that the promotions that mothers report for these products are much higher than for commercial complementary foods. It's important to note that this is just 4 countries and 1 city in each country. And so I just wanted to divert quickly over to some data that Euromonitor has put together looking at the market for commercial complementary foods in other regions, specifically Latin America and Europe. And what we can see in this slide for dried baby foods, like infant cereals, that there are places where the market for these products is quite high. In this slide, we can see Venezuela, Bulgaria, Croatia, Portugal, and Sweden have a very high per capita expenditure on these products, versus in Latin America towards the left, that market is much smaller. And while they are small, it should be noted that there's been a great growth in these markets over the last 15 years, both in Latin America and in Europe. And this is a similar slide showing the same information, but specifically for baby foods that have been prepared, such as pureed baby foods. So again, there are large markets more often in Europe, while the market is quite small in Latin America. But there are definitely growing markets over the last 15 years. And Euromonitor also delved specifically into some of the countries that they looked at. And so this slide and the following one is looking at specifically Norway and Brazil. And some things that were quite interesting is that what they had found were, there were similarities between that and what we found in the ARCH project. One thing to note is that they saw a strong need for convenience among mothers, as there's a growing demographic of mothers that are working outside the home. So we saw that for Norway and also for Brazil. And something that's interesting to note is that in the ARCH project, the promotions that mothers reported were most commonly seen on television and in stores. But there was a small amount that also reported seeing advertisements on websites. And Euromonitor noted that there's a growing trend for promotions to be conducted on social media and on the internet. And also what we can see here on the right are the key players or corporations that are involved in commercial complementary foods. And in this market, it has been predominantly dominated by Nestle for breast milk substitutes, but within the range of complementary foods, there's a growing number of companies that are being involved. To end with just some discussion, it seems that these snack food products in these 4 areas that we looked at under the ARCH project are playing a substantial role in these diets. These are foods that, while we don't have the exact nutrient composition of these snack food products, they are typically high in fats, sugar, and salt. And it's of concern given that many of these sugary snack foods can increase the risk of dental caries among young children. And they also have a strong influence on diet preferences and can really shape the types of foods that children will go on to eat later in life, and thereby increasing the risk of overweight and obesity and also chronic disease. And another area to really consider, and perhaps more research is needed, is looking at how the overconsumption of unhealthy foods that are empty calories can displace consumption of other nutritious foods, thereby not only contributing to overnutrition, but also undernutrition. And finally, we just wanted to make some recommendations in terms of programs, and we felt that there's a need for nutrition interventions to encourage the replacement of unhealthy snacks with more nutritious, affordable, and convenient options for mothers in order to improve infant and young child feeding nutritional status. And ensuring that mothers are able to make informed decisions is really a public health opportunity. As we see an increase in urbanization and growing economies, this trend of snack food consumption is very likely to continue to grow in other areas as well. And also there's a need to consider policies. These 4 countries that we looked at do have national policies looking at regulating the marketing of breast milk substitutes and commercial complementary foods, but we feel that there's a need to also consider these snack food products and also look at the enforcement of these policies. I just wanted to thank, first of all, the participants that participated in this survey and also the health facility staff, the members of our National ARCH advisory committees for their review of the research protocols, the greater HKI team, and also the Bill and Melinda Gates Foundation for their support of this research. Thank you.
Thank you very much for those very important 3 presentations. Kim has shared with us how important complementary feeding is and how important the quality of complementary foods are to prevent stunting and some other problems in children. Franz has given us an overview of where we are globally with complementary foods and feeding practices, also in South Asia and India. And finally, Alicia has shared with us